treating chronic fatigue syndrome, or CFS, with the use of alternative medicine and natural health remedies is quite popular today. However, please keep in mind that there's not a lot of scientific support for the claims that any type of alternative medicine or natural health remedy can effectively treat chronic fatigue syndrome in a medical sense. I have, however, gathered up quite a few scientific studies that show that there is hope in looking at natural health remedies and alternative medicine treatments for chronic fatigue. These studies are linked below this video. In this video, you'll discover 5 natural health supplements that have some scientific studies which verify that they can be effective for chronic fatigue syndrome, ME or CFS. In part 5 of this series, which is the very next video, you'll learn about another 6 natural health supplements that also has science which supports their use. Remember to always check with your doctor or healthcare practitioner before trying any natural health remedies, supplements or alternative medicine treatments. Coenzyme 10 or Co Q10 is potentially a very helpful supplement for chronic fatigue syndrome. This is a biochemical found naturally in your cell's mitochondria, which are the energy producers in your cells. Co Q10 is involved directly in the production of ATP, the main fuel that your body's cells burn to make energy. Co Q10 is also a natural antioxidant. A survey of 155 people with persistent fatigue discovered that Co Q10 was the most frequently reported effective natural health treatment. A scientific study also found that Co Q10 effectively reduced heart rate during exercise in people with chronic fatigue syndrome. In other words, Co Q10 makes it easier for your heart to do its job more efficiently, thus providing you with an energy boost. There's also a scientific study that explored the use of Co Q10 and NADH together for improving fatigue and other biochemical imbalances associated with chronic fatigue syndrome. You'll learn more about NADH in the next video. Remember, links to all of these studies appear below the video so that you can check them out for yourself. D-ribose is a kind of sugar that is produced by the body. It is also used as a medicine. Ribose is used to improve athletic performance and the ability to exercise by boosting your muscle energy. It has also been used efficiently to improve many of the other symptoms of chronic fatigue syndrome, or CFS. There was a scientific study done which found that 66% of people in the study reported significant improvements in their energy, sleep, mental clarity, pain intensity and well-being, as well as an improvement in their overall global conditions assessment. Check it out with a link in the info below this video. Ginseng is a herb that has been used in Asia for centuries to increase energy and combat fatigue. A survey of 155 people with persistent fatigue conducted by researchers at the University of Iowa found that ginseng was considered one of the most helpful treatments. 56% of the people who used ginseng indicated it was effective for them. Another scientific study found that Panax ginseng and echinacea each significantly enhanced cellular immune function in people with chronic fatigue syndrome. To be fair, there's also a double-blind study, a placebo-controlled study, that found Siberian ginseng wasn't any better than the placebo at reducing fatigue, so you'll need to try ginseng yourself to evaluate if it might work for you. Other natural health supplements which might be helpful for people with chronic fatigue syndrome include digestive enzymes, probiotics for gut health, vitamin C, magnesium, beta-carotene, licorice, melatonin, glutamine, whey protein, folic acid and tyrosine. Please be aware that most supplements aren't being tested for safely, and because nutritional supplements are for the most part unregulated, the content and ingredients of some of the products may differ from what may be specified on the product's label or what various manufacturers may offer by the same name. Also keep in mind that the safety of supplements for pregnant women, nursing mothers, children, and those with medical conditions or who are taking medications has not been established and should be approached with caution. Research the safe use of supplements, and if you're considering the use of any health supplements for chronic fatigue syndrome, talk with your doctor or primary healthcare provider first. Self-treating a condition with alternative medicine to avoid or delay standard medical procedure could have very serious consequences. Be sure to subscribe to my channel, like this video, and click the bell notification icon so you won't miss any of the new helpful videos that I create for you. I've placed a link below this video to our core team of professional natural health practitioners too. These are trained and experienced experts that can help you with any health, physiological, psychological, and/or emotional issues that you or a loved one might be dealing with. Many of them also have experience with helping people that are suffering from CFS. You can also work with them in a complementary way, right along with your medical doctor, and they can do internet or phone consultations with you to help you sort everything out to find some relief.